Our next speaker is James Albert, who comes to us from University of Pittsburgh and then finally Mississippi State. He practices here in Buffalo in the Greater Buffalo Veterinary Medical Emergency Clinic, or did, and then for a while at the Buffalo Zoo, and is also past president of Niagara Frontier Veterinary Associates.
All right, I want to thank everybody for potentially listening to me. I don't even know why I'm here. With all these esteemed people, I'm like, Dr. Noonan said, will you speak? And I'm like, how did you hear about me? And I think maybe a few people said something. He mentioned something about a bus driver, so I don't know how that whole thing got started. In any event, I'm going to talk about diseases of older cats. One of the benefits of having a cat is they live so long, right? And that's why we like them, amongst their other qualities. I have practices that see exotic animals, so pretty much having been the zoo vet, if you can get into the office, I've probably worked on it. So I've worked on lions in private collections, which we can debate that later, but I've worked on binturongs, coatimundis, primates, things of that nature. So I think cats are pretty cool because they're really low maintenance. And if somebody comes to me and says, oh, I don't know if I can handle this cat anymore, that's really saying something because they're nice, easy keepers. So I want to talk about geriatric diseases in our feline friends. So one of the biggest, most common diseases that we have in cats is, of course, feline hyperthyroidism. And that just basically means that we have a thyroid gland that is hyperfunctioning. So it's kicking out too much thyroid hormone. We all have probably friends like that work 24/7 and are very excited, and their eyes are bugging out of their head. To a seasoned practitioner, it's a pretty easy disease to diagnose. A lot of it you can see by sight because these cats, I'm going to try and get this laser pointer to work. Okay. So these cats are very unthrifty. They're thin. They come in and, the owners are reporting that they're racing all over the place, which can be problematic if you're trying to get sleep. So I'm going to talk about some of these diseases kind of systematically. So we'll talk about clinical signs, diagnosis, in other words, how we diagnose these diseases, and then lastly, how we treat them. So these cats, they're polyphagic, which means they're eating a lot. A first-year veterinary student should figure out that there's something wrong if my cat is eating tons and it looks skinny like that. I mean, that just doesn't make any sense. These cats are vomiting, and of course, I said hyperactivity. Diagnosis, a lot of veterinarians don't jump to specific diagnostic tests looking for specific diseases unless we're sure of it. We generally go from like broad-based deductive reasoning. So we might do a general chemistry panel, and when I see a high ALT, which is a hepatocellular leakage enzyme, then I know that there's something going on. And of course, we'll confirm that with a T4. Treatment really consists of kind of three things. One, and I'll talk about these individually. Tapazole is a drug usually given orally. However, there's transdermal applications, which some cats can still taste. And it's not a very pleasant tasting drug, but it's inexpensive, it's fairly effective, and its side effects, although documented, are fairly minimal. And I use Tapazole pretty regularly. For cats that cannot tolerate Tapazole, whether they have blood problems or, we'll see in a minute, pilling cats, there is a radioactive iodine which selectively destroys the thyroid gland, which I said in essence is what's causing the problem. And I-131 is very effective. It means no more medications. It is somewhat pricey. I think it's about $1,400 right now. And the cat has to have a stay at the VA for a couple of days, and because they do urinate radioactivity, of course, even in low levels, health department requires that they are sequestered. And lastly is thyroidectomy. And I think when I first started out of school, which is a long time ago, I worked with some veterinarians that actually did these. They've kind of gotten out of favor. I do a lot of surgery. I can't remember ever doing one, and for good reason. If you look here, you'll see the thyroid gland there, and there are a pair gland. There's a parathyroid there, which is critical for regulating calcium. And if you start messing around with your calcium, that's a real problem because that can kill you either way. So you've got to be very careful about that. Marsha, I don't know if are you doing any thyroidectomies or? Yeah. there's just too much. It's very bloody. There's a lot of risk, and it's just very technically demanding. We just don't get into it when we have I-131 and certainly have Tapazole. Another way you can diagnose it, and I'm usually not this fortunate, but you can see this rather large thyroid that it's palpable. You can feel this. Some veterinarians can just put their hands on these thyroids. Oh, yeah, it's got a hyperthyroid condition. I can't feel anything. That certainly would be able to be felt, I think. All right, so I saw this when I was preparing for this lecture, and the cartoon says, "Good morning, Mr. Norton. We are just calling to see if you've been getting Binky's pills in okay." And he's pretty tore up. That's certainly not an easy thing to do for some cats. This pillar, which it's almost impossible to harm a cat with that, this pillar makes it a lot easier, and you can certainly treat hyperthyroidism quite effectively at home. And I mentioned that they have a transdermal paste. You put that in the inside of the ear, and no fuss, no muss, and everybody's happy. I'm not convinced that you get really good circulating levels of the drug in plasma in order to be effective, but obviously for an individual like this that's pretty scarred up, that might be something you would consider. Okay, the next thing we're going to talk about is renal disease, and I put these diseases together because almost over 20 years of practice, these are just the things I see. If I get an older cat, these are just the kind of diseases that I can pretty much say if a cat comes in unthrifty, sick, it's going to have one of these diseases that we're highlighting here today. So renal disease, layman's terms, is kidney disease. And we can see our hospitalized patient. He's got the IV catheter in that bundle there. And this is obviously a sick cat. Cats in general, I don't know if I did. Cats in general can handle renal disease pretty well. I mean, they're great conservators of water. Human beings and dogs generally don't tolerate renal disease as well as cats can. And in fact, you can manage a cat almost to a normal lifespan if you're doing it with fluids, etc. So clinical signs, vomiting, weight loss, lethargy, dehydration, uremic smell of the breath. Clinicians can actually smell the cat's breath, and it smells very ammonia-y, if you will. And the reason for that is because the kidneys are failing, and their job is to get rid of nitrogenous waste products, and when that's not happening, that's going to build up in the bloodstream and cause vomiting and things of that nature. So we will see that. Diagnosis is fairly easy. We do a blood test, and we see elevations in blood urea nitrogen and creatinine. And again, this is highly variable. I mean, there are some cats that come in and their creatinine is off the wall, and some of them and they're acting fine, and some are very low, and they're really sick. Treat underlying infection, diuresis with IV fluids. Unfortunately, dialysis, as we know it, is not available in cats. And at one time, University of California at Davis was doing renal transplants. I don't believe that's available anymore. And it's very pricey. It's about $5,000 to $6,000. And we use renal diets. A lot of people can, well, before I get to that, I guess I'm going to talk about kidneys here. Big kidney, normal-sized kidney, small kidney. What we learn in veterinary school is acute kidney failure generally is kind of a swollen kidney. It's just reacting to the insult. Normal kidney and then a chronic renal disease. These kidneys are very fibrotic. They're very hard and dense. Bottom line is they're non-functional. Subcutaneous fluids can be administered fairly easily at home. We have owners that do that. Surprisingly, that's easier for some people than giving pills to some of these cats. And this can help them live a normal lifespan. I always tell people to warm the fluids first. Nobody likes having a few hundred cc's of cold fluid going down your back. So once they do that, the cats are generally in pretty good shape. Diabetes. Honestly, doctor, I only feed him this much. Right. Okay. That's a very large cat, and that's generally the predilection for diabetes in its early stages. And I'm going to be go here kind of rapidly just because for time constraints. But these cats, they go from being heavy to losing weight. They're eating a lot. Interestingly, some of these cats have dandruff. I don't know what the connection is. Muscle wasting along the back end. Diagnosis, it's a really simple disease to diagnose. A resting glucose over 300 milligrams per deciliter pretty much covers it. You can have other parameters, but really it's pretty easy to diagnose. Treatment represents pretty much insulin. I haven't had a lot of luck with sulfonylureal compounds. I don't know if anybody else has. We pretty much just go right to the needles, and people don't, again, usually are pretty good about doing that. And a high-fiber diet, especially in a heavier cat, there's a lot of people use high-protein diets, low carbs. But for a cat like this that's recently diabetic, I'll use a high-fiber diet. Okay, and there's the treatment with insulin. Neoplasia, which means cancer, and sometimes we make this diagnosis because we can't figure anything else out. This is normal, that's normal, it's got to be cancer, and unfortunately we have our pick of cancers. The big one is lymphoma. It's 30% of all tumors, so it's very widely represented, usually the GI tract. Vomiting, diarrhea, weight loss. These are cats that you just can't find anything wrong with. Everything's coming back on a blood panel. It's pretty normal. Some of your imaging may be normal, such as X-ray ultrasound, but however, we know this cat's sick. Chemotherapy is fairly well tolerated. I think a lot of people shy away from that. There's no reason. Animals tolerate chemotherapy a lot better than people because animals, I think, are just more stoic and better patients than people, which is why I'm a veterinarian. Vaccine-associated sarcomas, these are the tumors you get with injections. They're very aggressive tumors. They're very frustrating. A surgical excision the first time is your best chance to get rid of these. However, because of the incidence of some of these diseases that we're ostensibly trying to prevent, we shouldn't forego vaccines. We should vaccinate cats based on what their exposure to risk is, of course, not being cookie cutter, but tailoring. Squamous cell carcinoma, I have a few interesting pictures there. This is a really aggressive tumor in the mouth. That's a very poor prognosis. I've done hemimandibulectomies, partial maxillectomies on these cats to remove them, and sometimes I get lucky and I get it all out. You can see that here's a cat. Sometimes it presents under the tongue, so you'll see that there. It's not only just a soft tissue sarcoma, but it also can have bony or osseous involvement. It's literally dissolving that mandible. This was a tiger I did at the zoo. Her name was Riza. Unfortunately, she's not with us. She's an Amur tiger, and you can't see it from this picture. I'm just getting ready to take a sample. And she has this under her tongue. Unfortunately, because of its high metastatic rate, which means its ability to spread someplace, I was unable to keep her for a long time, so she eventually succumbed to that disease. When I was there, we basically knock down animals once a year, give them a full look over, make sure everything's okay. Unless, of course, the keeper is reporting that there's some abnormal behavior, which is, if it's credible, then that's immediate cause to go and pursue diagnostics, obviously with anesthesia. And time doesn't permit me to tell a few close calls that I have because my wife is in the audience and she doesn't know about them. So we'll just we'll leave that. And lastly, I guess that's all I have. I really became close to this cat. This is Magic. He is a juvenile Amur tiger from a private collection, and he has, there's a lot of pus here. He just had a bad tooth, which needed to be extracted because it was fractured at the gum line. I think I removed that with a canine elevator, a hammer, and a block of wood for a gag so it wouldn't bite down. That's called field medicine. Not necessarily ideal, but for a cat that weighs 420 pounds, and you can't usually truck them without getting stopped, probably. Thank you very much.